Doctor, you mentioned that there were certain people who were more at risk for this condition. What are the risk factors?
So risk factors include having underlying lung disease, such as chronic obstructive pulmonary disease, as you said earlier, or otherwise COPD, or having bronchiectasis, as in Dariel's case. Those patients are more at risk. In COPD patients, you're at 16 times more likely to have NTM lung disease. And in patients with bronchiectasis, about 50% of them have NTM lung disease. If you're older than 65, we see an increased risk, and that population is increasing. If you have a weak immune system, if you happen to be on chemotherapy or other immune suppressing drugs, it's more common in women than men. And we also know that it's more common if you live in a state that's in a coastal area. 7 out of 10 cases come from those states.
Okay. Once you're infected by the bacteria, doctor, what symptoms would a person have?
So the first thing to note is that not everyone who's infected with NTM lung disease will have symptoms. Many patients can go months, even years without symptoms, and sometimes patients are diagnosed when they're having a chest CAT scan for another reason.
Okay.
Patients often will develop symptoms, or they will have a common cold that doesn't go away that brings them to their doctor asking, why isn't this cold going away? And those symptoms are the common pulmonary symptoms, such as cough, sputum production, fatigue. They can have weight loss. They can have lack of appetite, low-grade fevers, night sweats. They can just have recurrent infections that aren't going away with routine antibiotics, and that may alert them that maybe they should be asking someone about NTM lung disease.
So when you say sputum, you mean they get more phlegm?
Yes,
Okay.
they get more phlegm.
Okay, so Dariel, tell us a little bit about the symptoms you experienced that brought you to this point.
Okay, well, I only experienced a few of these symptoms. As I said earlier, I started with a discomfort in my chest, and then I had repeated respiratory infections with a non-productive dry cough over the course of the next several months. When I saw my pulmonologist, he initially thought I had organizing pneumonia, but after some additional tests, he suspected that my GERD and my bronchiectasis were contributing factors to the symptoms I was having. When one of the CAT scans I had some significant changes, it gave me some concern. So after speaking and consulting with my family and getting their support, I decided to seek some more opinions on my disease, and my diagnosis was confirmed in 2015.